Welcome, everyone. So our conversation today is a conversation directed towards grandparenting, towards the acknowledgement that being the grandparent in waiting, knowing that there is a couple that is attempting to have children, that are struggling to have children, either because it was a known diagnosis, they're aware that there was something that was on their plate that they were going to have to cope with and deal with, or something where they began to try to conceive and they didn't get pregnant. And time is passing, and what that is like for their parents to experience. It's something that I think is one of a more confusing space, because I think when you have a relationship with like a friend, right, you're with somebody who is on similar level as you, a similar peer group as you. There's, you can kind of figure your way through that. But when there's a relationship that has its own kind of expectations, its own rules, I would even say, especially because when we're dealing with in-laws, right? It's not just the mother, it's also the in-law family member. When we are dealing with these situations where there is a unique dynamic, it calls for a unique or more sensitive response, right? And that's one of the things that I think creates this complexity where coming into the relationship with this young couple, there's already this this dynamic that can be stressful. It could be beautiful. It could be, oh, I love my daughter-in-law, she's awesome. It could be, my daughter-in-law doesn't love me and I don't know why. It could be, I'm very close with my daughter, but she doesn't talk to me about her personal life. There's so many different aspects of this relationship that can create an extra hardship or harshness to a scenario where there is a challenge in play. And so in thinking about that, I want us to also acknowledge that there isn't a clear set of guidelines or rules. It's not like I can open up my textbooks, find how to be a grandparent of somebody, a parent of someone who's struggling with infertility, how to be somebody who is a grandparent in waiting, how to manage if your older child has no children, but your next child already starting to have a family. Like, how do you navigate that scenario? There's no textbook that describes these situations for us. And therefore, there's also no that's even like a best practice. There isn't even a guidance for us to say, like, this is exactly how you do it. And then I could tell you that you're getting it right? And what's complex about that is that when I can give you information, advice, guidance, ideas in how to navigate the relationship, it could work for your child. It could be a total disaster for somebody else, right? And that's where one of the things I want us to kind of keep front and center is that what I will introduce to you, or what some of my perspectives might be, could work perhaps for most people, right? At least based on what I've learned and what I've heard and what I've experienced, it will work for most people. There will always be scenarios and situations where your child will be that outlier. Your child will say, I can't believe my mother said this to me, versus somebody else's child will say, I can't believe my mother said that to me. That was so kind and compassionate, and I'm so appreciative, versus somebody else's child who will say, that was a horrible thing to say. And I think that what we've learned is that we do the best we can, and we talk to our children, the adult children, and we say, I hope that you will understand that I'm doing the best I can, like you're doing the best you can, right? We, as a community of fertility supporters, we actually have this conversation with people who are going through fertility treatments. We'll say to them, one thing that we have to consider is how to have grace for your parents. Like, they're doing the best they can. Yes, is there spaces where they're completely insensitive? For sure. Are there experiences where you really feel they could have done better? For sure. And because there is no textbook and because there are no guidelines, we have to believe like the best of people. At least that's my perspective, and to give them grace, to be respectful of the fact that they are struggling too and trying to figure this out. I thought it was interesting recently. I had a conversation with somebody who was talking to me about the fact that they had a pregnancy loss, and she expressed to me a resentment. And she said, my mother talks about it as if she, that she lost a grandchild, and she is sad about it, and she acknowledges it, and it's so painful to me because I actually don't want her having any part of it. It's my child that died. It's my child's experience. This is my baby. And I don't want, my mother doesn't get ownership of that. My mother doesn't get to be like sad to her friends. It's not okay. And then I could have the exact same conversation with somebody else who says, when my mother acknowledges that she also lost a grandchild and she's also grieving the loss of a grandchild, it's so validating to me as a parent that this happened, that this is real, that you see me, and that you also know this sadness, right? Elu ve'elu, as we say, this person and this person, same scenario, and yet the experiencing of that scenario is going to be different. So that just kind of puts us in the space of like, okay, so what am I supposed to do? Like, how am I supposed to navigate this if there's no great, best practice, or like, this is the way we should do it? So I think like just kind of recognizing that when people are hurting, when your children, your adult children are hurting, especially, right? One of the things to acknowledge is that when people are hurting, they're not their best selves, right? They're not in their best form. They're not, saying the right thing. They're not necessarily being kind or compassionate. They're really, they can really be not in their best shape. So first and foremost is to recognize that when the children are hurting and are scared and are overwhelmed, that what comes up and what comes out very often is not aligned, even like how we would define as like with our values, right? Why did you behave that way? Why did you respond that way? Your sister didn't mean anything by it. Why are you so sensitive? Why are you so overreactive, right? So first and foremost, I think recognizing that the experience is one that is coming from a place of deep pain. When we are in deep pain, we are not our best selves. And that's actually one of the challenges, we talk about with people that are post-death, post-losses, that very often that's when families fall apart, right? You've all seen that, where families completely unravel. This beautiful, lovely, engaged family unravels after Shiva. Very often it's around inheritance, right? But it is also really something where it's a matter of our emotions were on high alert. Our experience was really like very sensitive. I'm not my best self, and this is my response. And we end up unraveling relationships. I recently had a conversation with somebody, a friend, somebody who I really respect, somebody I trust, and somebody who I really like. And recently my conversations with her have been very, very, I wouldn't say high conflict, but like they're kind of like rubbing me all the wrong way all the time. And I'm like, what is going on here? Like, am I being oversensitive? Am I not getting our relationship right? Like, maybe I don't want to be a friend anymore, right? But actually, like, my husband actually was the one who pointed out to me, he said, she recently lost a very close family member and she hasn't been the same since. And I'm like, oh, right. She is grieving. And when a person is grieving, perhaps they can be more sensitive, more abrupt, more gruff, more rough, right? Like put in the words, but those are experiences that do happen when a person is in this grief space. And I think that when we're talking about infertility and we're talking about the struggle to conceive children and create your family, it is a space of grief, right? Our people are grieving, our children are grieving. I also think we have to acknowledge that as their parent, it is so painful to see them in that grief space. You can't necessarily help them or fix it. And what do we all want to do as parents, those of us that are blessed with having children? A lot of our job in life is kind of to make them feel better, right? To comfort them, to support them, to tell them, you got this, we can figure this out together. Like, oh yeah, I'm so sorry your teacher was so mean to you in school, right? Like, I'm so sorry that you fell, let me kiss your boo-boo, right? Like, that's what we do as parents. And in this space, we are very much helpless. And even if I'm able to provide finances, right? I've heard Rabbi Bachner describe from Bonei Elam, who says, just open up your pocketbook, and that's one strategy, right? We do very often need the financial support of family members, but beyond opening up your pocketbook, which I highly encourage you to do because it is an expensive, very expensive, experience, but we also have to open up our hearts a little bit in a way to acknowledge that I need to figure out what it is that my children want from me, and they may not know. So one of the kind of guiding principles that I would like to suggest is this concept of like asking to ask. So saying to our child, is it okay if I ask you what's been going on? Or is it okay for me to ask you how your procedure went? I know that you had said you were starting up treatment this month, this week, this year. Is it okay for me to talk about that with you? Do you want to tell me if you're okay with me asking you a question? Would you like me not to ask you any questions? Is it okay with you if I just give you a hug and let you know that I know that you're hurting? Like finding the language with which to engage in what we call a trauma-informed way. asking permission is actually trauma informed. Now, some of you might be saying, but I'm her mother. Like, hello, I'm her mother. Like, I have a relationship with my child. That's great. But even when you have a relationship with your child, being trauma informed when they are going through some extraordinary experience is only going to work within your benefit, right? So the way that we would recommend that is to say, can I ask you permission? I am asking you permission to engage. May I ask you about how that appointment went? Can I ask you how you're feeling? And you have permission to say nothing. If you say, Mom, I don't want to talk about it, you as the parent have to be respectful of that answer. Your instinct might just be like, tell me, I'm your mother, let me help you. Like, I can handle it. But recognizing and respecting the adult child in that room and saying to them, I am with you and I'll be with you in whatever way I can. And I know it's a complex space for both of us to exist in together. There is a difference between being invasive and being supportive. Sometimes it's difficult to identify what is invasive and what is supportive. And that's why asking them, even if that's like not your normal layer of conversation, like that's not typically how we like kind of engage with people, is to ask them, can I ask you if I can ask you? But in this situation, I would suggest that it is really the most appropriate thing to do, to say, can I ask you about what happened? Or is it okay with you if I just acknowledge, I would like to acknowledge that you've gone through a rough week. So how would that look? Supportive is things like, I recently had a woman who said to me that her mother said, here's my credit card, go order yourself dinner. I know you had a rough week. I'm paying for dinner Wednesday, Thursday night. Here's my credit card, order yourself takeout. Another parent sent in like a gift basket. Another parent said, I'm treating you. I want you guys to go away overnight, right? A lot of these gifts are financial, but it doesn't have to be high-priced financial. It could be, I'm sending you a new book. I read a new book and I thought it would be something that you would enjoy or appreciate. Send the book, right? I love you. I care about you. I know it was a rough week. That is supportive. Invasive would be more like asking detailed questions about how things went. One of the things that I hear also the most is that, we kind of manage the questions for as long as things are in the process of treatment. But the minute it works, like, couples don't want everybody to know they're pregnant, right? They want a little bit of privacy, just that special moment of like, oh my goodness, this worked. So if I have told my mother that I have been going through treatment, or my father, or that I have been going through treatment, and they know when transfer was, and they know my numbers, and they know that I'm going in for testing, then all of a sudden I've now obligated myself to tell them when I'm pregnant from the first confirmation of pregnancy. And I think that we as parents have to be mindful of allowing them that dignity of privacy for those moments that are so precious between a couple. And the practice knows, right? All the nurses know, everybody, the therapist for sure knows, right? I know when people are pregnant from day one. It's such a long pregnancy, by the way. 9 months is such a long time to know that someone is pregnant. But I do believe that we have to say to them, like, you'll tell me if there's something that you want to share. And you know what? If they haven't told you, they might actually be pregnant. And don't ask questions. At that point, let them come to you. If you know there's a transfer day and you know that if they've shared that with you, acknowledge it in some way. Send a loving text, send a loving card, send a book, send a piece of chocolate. I love you. I care about you. I know this week is a procedure week. You've been on my mind. I caution around the I'm praying for you. There's a lot of kind of conflict in how that is received. Daven for them, please daven for them, but they also know that you're davening for them, and you don't need to tell them that you are davening for them. It almost feels like I hear from couples like this expression of resentment. Like, why are you telling me? Of course I know you're davening for me. Why are you telling me? What do you want me to respond? Great, thank you. Like, just do it and don't tell me about it, because it makes me actually feel, and this is the word I'll hear across the board, I feel like a nebuch. I feel like a nebuch, and I don't want to feel like a nebuch. So just pray for them. It's very interesting for those of you who have ever experienced an illness, a medical condition, a situation, and someone says, tell me your name and I'll daven for you. I don't know, personally, that's one of a heart. If somebody says to me, what's your family member's name? I'm happy to give it. But if somebody says, what's your name so I can daven for you, it always chokes me up when I've had those, thank God, not common experiences in those moments in my life. But if I've been asked, well, tell me your name and I will daven for you, there's such a feeling of, it makes me emotional to think about it. And it makes me emotional in those moments. I'm not even 100% sure why. But I think part of it is we want to always, we like to feel like we're in like a strength space. And when someone needs to daven for me, it feels like a deficit. And perhaps that is what our couples are experiencing. Pray for them, but don't tell them that we're praying for them. But doing things for them, small little tokens and gestures of connection, says, I've got you, we've got this, I love you no matter what. And that's the last thing that I want to kind of really hone in on and focus in on, this idea of loving them in an actual practical way, loving them even when they do not have children, and especially when they do not have children. So I had a woman recently who is about to move into a new community. And she said to me, I don't know that when my parents will come visit, because, parents go visit their grandchildren, but I don't have grandchildren. So why would they come visit me? That is such a gulping moment of like, oh, how did we end up here? That a child, an adult, responsible, respectable, accomplished person feels like her only value is if she has grandchildren, for them to come visit. And I explained to her that, I said, you're moving to someplace warm, they're going to come visit no matter what. She's like, I hope so. But that a child, an adult child, would feel like the only value they offer is whether they have grandchildren for her parents to come visit, tells you a little bit about what some of that internal monologue is, right? That internal conversation of, how do I identify my value, right? What is my value in the family? And I think that's where parents really have to step it up, where parents have to express, your value is independent of you having children. And frankly, it even takes it one step before that, is to say, your value is independent of you being married, right? Can I express my adoration and my respect and my love for my child, even when they're not partnered, right? And our singles are feeling that just as much as our marrieds without children. And I think that, there is something to be said to that idea of being knowledgeable and sensitive to, how do I actually convey that I adore you, that I think you're awesome, whether or not you have children. So some just examples of that might be really highlighting their successes, right? So if their successes in work or at home, or, they share with you something that they did in their apartment, like croon over it, like, whoa, tell me more about that. Where'd you buy that couch? It's such a cool choice. I love your fashion sense. I love your style, right? Like finding the things, or like, whoa, let me see that shirt. That's gorgeous. Where'd you get it from? It looks so beautiful on you. Not commenting on their body, but just on the fact that you admire how they're presenting themselves to the world. And especially as they're growing older, as they hopefully are contributing members of society, see what they are contributing to society. Acknowledge the good things that they are doing. And when we do that, we say, you matter, independent of you having grandchildren that I can adore, right? You matter, your lives matter, your experiences matter. It could be in terms of spending time with them, alone, without the other siblings that have children. It could be taking them out for dinner, say, come, I want to spend time with you. I want to spend the week, a couple of days with you. I'm coming out to visit. It could be really just listening, authentically listening without distraction to the things that are valuable in their lives and the things that are meaningful. And with recognition that it's got to be more than just their fertility treatment, right? Okay, we've talked enough about your medical care. How are you doing? Tell me about your work week. What's going on at your office? How's the new boss? And really exploring whether you really care or not, do it anyways, pretend, right? Like really beginning, making sure that you're maintaining a relationship with them individually as a couple, because when they, God willing, will have children one day, you will have created this beautiful foundation of a relationship that is not dependent on your relationship with your grandchildren. And ultimately, I think that's really crucial, right? That is the essence of human connection. It's not dependent on what you are, who you are, what you accomplish, what you bring into this, into our family, but that you are a valued, precious member of not only our family, but of community and society as well. And then finally, really like allowing grace, allowing them to go through tough times, to retreat if they need to not show up at the yontif table, even though you really wanted them there, to be able to say, no, mom and dad, we're not coming for Seder, or we're not coming for yontif davening again. My husband just wants to daven where we live, right? Those are the kinds of things that might challenge you a little bit, but why? Come be with the family. But sometimes being with the family is too much. It's too overwhelming. Let them be. Tell them that you adore them with whatever decision they make. Allow them the permission to make decisions that you will not agree with. And I think that idea of allowing them grace, even grace to be in a rotten mood, right? Sometimes we have to remember that our behaviors look very much like toddlers, right? We could be little children kicking and screaming like, I don't want to deal with this. I don't want to do this. And I, sometimes we'll see it actually in the therapy room. Well, I'll watch women act like toddlers because they're in so much distress. And if I can do that without judgment, that's where the therapeutic space happens, right? That's the therapeutic work, is like, okay, so kick and scream, I can handle that. I have one woman who's screaming and yelling at me about how angry she is that everybody else has a family and she does not. And if I were to be that mommy in the room, which might call out her bad behavior because she gets pretty obnoxious, we wouldn't have any therapeutic space. But if I can totally see her through the lens of compassion and of somebody who's deeply, deeply in pain, then the fact that you and I can still have that relationship, even when your behavior is not exactly as I expected it to be, or that I can still kind of move beyond that into the relationship space with you. And isn't that what we're all hoping for? Right? That even when our children are suffering or struggling, we continue to maintain a meaningful and valuable relationship with our children, and that they feel like they have a meaningful and valued relationship with us. And ultimately, I think that's the goal. So continuing to maintain connection, relationship, that when that baby is finally born, you can truthfully and authentically step right into that role of grandparent, because you have mastered that role as best we possibly can as being a parent. So with that, I'd like to thank you for listening and participating in today's conversation.